Hello and welcome to Unstress. This is Dr Ron Ehrlich. My guest today is Leah Hechtman. Leah has written one of the seminal textbooks on naturopathy. She has over 20 years of clinical experience and, like so many practitioners, just keeps learning, as you will hear. So I thought she'd be well placed to share some insights. We will also discuss the interplay of the immune system and the microbiome across our life cycle. It's sobering to think that there are about 50 trillion cells in the human body, give or take. Difficult to get your head around, I know, but if you look at the person sitting next to you, or for that matter, just look in the mirror, that's pretty much what those trillions of cells look like. But that's not all we are. What's even more amazing is that there are 10 times that number of microbes we share our bodies with. Some 500 trillion microbes. Again, what does that look like? Well, again, just look in the mirror. So in terms of relationships in your life, I doubt whether you could argue there is a more important one than that. You hear lots of terms in podcasts and articles on health, so today we give some definitions. Immune system, microbiome, autoimmune diseases, probiotics, prebiotics. Look, there are some great insights in this episode. I hope you enjoy this conversation I had with Leah Hechtman. Welcome to the show, Leah.
Thank you so much, Ron.
Leah, we are both talking at an upcoming conference and you're presenting about the interplay of the immune system and the microbiome across the lifestyle, and we're going to talk about that. But you've been in practice now for 20 years and you've actually written a textbook on naturopathy. So I wondered if you could share with our listener your journey to this point.
Absolutely. Thanks, Ron. I have always been connected to health. I was one of those kids, 2, 3 years of age, and I'd put my hands on people and take their headaches away. And, I was always the person that was, the nurse that ran around trying to help everyone. So I always knew that I wanted to be in some form of health. And as a young kid, my understanding was that meant that I wanted to study medicine. And I then was sick as a child and then quite sick as an early teen, and had difficulty completing school because of my health, and went, well, I know that complementary medicine helped me, so why don't I start my training in complementary medicine? So at 17, I started my first subject of naturopathy. And so I took probably 1 to 2 years longer to complete my naturopathy training because I couldn't do it full time. But as I was training, I just got healthier and healthier and thought, well, I'll just go back and study medicine afterwards. And then got sick again in my training where I wasn't able to be as active, and then got well again and then went full force with my naturopathy, and then did a Bachelor of Health Science, my Master's in Reproductive Medicine and Genetics, because my main clinical passion is about fertility and reproductive medicine, and then am completing my PhD at the moment. Medicine's still a passion, but in amongst all of that, I've had kids, and the idea of full-time training has been a bit tricky. But, I'm sort of at that place now in life where I'll consider when my kids are both at school whether or not I'll go back and train in medicine, but I'm certainly very satisfied and feel like I can make an enormous difference with the training that I've got. So it really just comes down to choice now.
Wow. So, PhD, go on, tell us you told me this last time we spoke, and we're not going to go into it, but share with us the topic.
Well, the simplest way to describe it, because always in PhD, you give the title and everyone's face kind of goes blank because it's so specialised. But basically it's looking at women with some reproductive disorders and their fertility and trying to understand and track how we can assess their fertility. So we're looking at things called ovarian biomarkers, and there's a number of new ones that are coming out. So we're looking specifically at women that have polycystic ovaries as well as early menopause.
Yeah, and that subject, the subject of reproductive health and pregnancy, in fact, is such an interesting one because it really is what lays the foundation. It gives us a sort of a snapshot of where we are health-wise as a community, and it also gives us a snapshot of where kids are heading. So it's actually interesting and important to everybody, not just people who are interested in having kids.
Absolutely. And I think, we're in an interesting time in life because we've got 3 generations of women trying to have babies at the same time. 20-year-olds, 30-year-olds and 40-year-olds. And as well, there are some women late in their 40s, early 50s that can use donor embryos and things as well. But it's a very amazing time, and I think that the information that we're connecting to and the understanding of the importance of what we can do for our kids before we conceive them is so powerful. It's pretty profound what I see in practice and certainly what I see in research as well.
Because there are some pretty significant problems going on out there, aren't there?
Unfortunately there are. And I think, the conference that we're both speaking at, the MIND conference, really is such a valuable resource for parents as well as for clinicians, because, it gives them the opportunity to connect to the latest research and all the clinical experience to understand what they can do. I mean, the incidence of all the neurological disorders and the spectrum and disorders, it's frightening. It's really frightening.
Yeah. Now, at that conference, you're talking about the interplay between the immune system and the microbiome across the lifestyle. Now, we kind of assume people are familiar with all of these terms, immune system, microbiome, but I actually think it's quite helpful to go back to basics. And I wonder if we could just spend a little bit of time defining the immune system for our listener.
Absolutely. Look, the immune system, the simplest way to describe it is it's the part of the body that is the interface between the inner and the outer world and helps our bodies defend itself against anything externally that may come into us internally. And it's our defense mechanism, how we can survive when essentially our body is covered in bacteria and different microbes, and as well, the environment around us is just, there's bugs everywhere, and it's how our body defends itself against those things.
Yeah, and then of course the microbiome as well, and that's a term people are just hearing all the time. Yeah. Give us a bit of basic. What does it mean?
The microbiome is basically, it's like the bugs that are in our body, the good bugs within any system of our body, we have them present, and the balance of the bugs. The more we research it, the more we're understanding that we don't know a lot yet. We know about probably, 5-10% of what we will discover over the next 10 years as science improves. But what we understand is that we have a balance in our body of good bugs and bad bugs, and when that balance gets disrupted, then our immune system can't protect itself as efficiently as it can, and our various organ systems are more prone to having the immune system weakened in that area.
Yeah. And I mean, I know that I was surprised to learn that there are 10 times more microbes in and on our body than there are human cells. So we've got 50 trillion, say, give or take, cells in the human body, and that means we've got 500 trillion microbes. So one could argue we are just a vehicle for microbes.
I know. It's pretty scary when you look at it like that.
It is. But by the way, how do we know when we've got a healthy microbiome?
A healthy microbiome, I think, is when our systems of our body are working well. Like if you focus on the digestive system, it's having normal bowel movements, normal bowel habits, not having any disruptions or associated symptoms, and just everything functions well. And, when your gut functions well, your mood functions well, your concentration is optimal, your sleep is really good, and then the ripple effect is that everything works properly.
And the corollary of that is that if any of those are out of balance, then, hey, maybe your microbiome is too.
Absolutely.
Now, another term that I think, I just want to get a few terminology. This is the intro part of our talk. But another term that I think people hear a lot about is autoimmune disease. And although we're not going to specifically go into it, I think this is probably a good opportunity for, maybe you could just explain what that term means.
Well, an autoimmune condition is really where the immune system starts to attack itself. And so you can have an autoimmune condition on any single cell in your body, in any system of your body. And so if you, for example, look at an autoimmune digestive disorder, the immune system is attacking the repair of the digestive system or attacking the cells in the digestive system. And, all the new research is seeing that those autoimmune conditions are exacerbated by an unhealthy microbiome as well. And the microbiome is what protects us and regulates and stabilizes that immune reactivity.
Yeah, it's kind of the way that, I mean, we could give some examples because it's the way your genetic predisposition really might determine how that manifests itself. Would that be a fair comment?
Absolutely, absolutely. It's a good point that you're bringing up. I mean, autoimmune conditions, there is the belief that they are genetically passed over, and then there is that concept of epigenetics. So whether or not that gene is switched on will determine whether or not that genetic predisposition is activated. So, you could have a genetic predisposition. Your parents might have Crohn's or ulcerative colitis, for example, to inflammatory bowel disorders. And then if you eat a rubbish diet and have an unhealthy microbiome, that switches that gene on and can set that autoimmune condition off in your body.
Yeah, because it's interesting. I mean, the sort of reductionist, typical, I go and see my doctor and I've got rheumatoid arthritis and you'll get an anti-inflammatory, and I've got a skin condition, so you might get a corticosteroid cream, a psoriasis, and they're both autoimmune conditions. But in a typical sort of a traditional approach, they are treated as separate entities which require separate medications. But in fact, there's a common theme there. It's just manifesting itself genetically, isn't it, really?
Absolutely. Unfortunately, I see that regularly in practice. I've got one patient that springs to mind, and it started with ulcerative colitis, and then slowly all these other autoimmune conditions developed. And this is a young woman, 37 years of age, and she's got 5 autoimmune conditions. There has to be some connection there, and often that connection does definitively correlate with the microbiome. What has made the immune system so aggressive against itself? And healthy diet and healthy lifestyle cannot be underestimated there.
Okay, so let's talk about the life cycle, because when does our relationship with the microbiome start?
Even before your parents or the sperm and the egg actually meet. So we all think that, it's just, when the baby's in the mum's tummy growing in the pregnancy. But even before they actually conceive, their health has a direct impact as to the subsequent health of the child. Pretty fascinating research coming out at the moment.
Yeah, I think last time we spoke, you were mentioning to me that the sperm is affected by the father's microbiome.
Yeah, there's some new research coming out at the moment looking at the semen itself. So the sperm is swimming in the semen, and that's its travel mechanism essentially. And there's some research coming out that shows that the mum's immune system and her reactivity to accepting the sperm and accepting the ability to actually have conception is directly related to the quality of the semen, because there's various immune regulating chemicals, so to speak, within that semen that normalise both the vaginal health and the vaginal ecology, as well as improve the transport of the sperm. So, the quality of the semen that is transporting it determines how the mother accepts it, essentially. So, and they were comparing it to IVF pregnancies, where obviously they're taking the sperm out with no semen and finding that the women were having, marked immune reactivity against it. And so then there's been subsequent treatments, where they're trying to normalise the immune response in the women, taking some of the platelets from the father and then injecting it into the mother, and all this sort of immune modulating treatments and things. It's quite alarming and fascinating and exciting all at once.
Is there a microbiome within the semen?
There is an ecology in there, yes.
Wow. And I mean, one can only, in the vagina obviously must have its own microbiome. And so that has got to play a pretty major role as to how things proceed.
Yeah. I mean, even just the fundamental of the conception window, we know that the woman's, vaginal ecology is naturally very acidic, and we know that sperm hate acidic environments. So we know that the female body changes to become more alkaline by producing fertile cervical fluid and things like that to make the environment more hospitable to sperm. And similarly, with increase in pheromones in the woman and stuff, it changes the semen pH for the male to actually make the two of them meet. So we know that there's all these changes in pH which are directly governed by all that microbiome aspect, and that's the harmonisation of the two of them.
Wow. And so, sperm, ovum, connection.
Yep.
Where do we go from there? I mean, I know where we go, but microbiome stuff.
For sure. Yeah. Well, obviously we've got the fertilisation, and then we've got the transport towards through the tubes towards implantation, And the microbiome within the uterus and within that whole reproductive cavity determines the pH and determines, has a direct influence to the immune receptivity of enabling implantation. So whether or not that embryo can implant into the uterus, embed itself and kind of glue itself there, the quality of the microbiome there influences that success. And then similarly, as that embryo grows and embeds into the uterus and starts to develop and, continue its growth as it progresses, develops obviously into a fetus, the microbiome has a direct influence on that. There's lots of correlation with immune reactivity and miscarriage, or immune reactivity and influence on the mother and then her health and then the quality of the embryo. It's a phenomenal, intricate balance. And the microbiome seems to be such a foundational component of enabling that to happen successfully.
So here we are with the embryo, and we've got the gestational sac, which we've always thought was sterile, but is that still the case? I mean, what do we think? What's the latest on that?
Well, all the latest research, we used to think that, the mother and the baby was separated by the placenta, basically. Of course, don't go drinking 2 bottles of wine when you're pregnant. But we didn't understand that actually, phenomenal research coming out showing the cross-transfer of probiotic species through the placenta. So we know that, if there's a strong family history of skin disorders, eczema, something like that, the types of probiotics that the mother takes or has in her system that passes through the placenta can influence the incidence of that in the child. So if she takes a probiotic in pregnancy with a strong family history of eczema, then she reduces the chance of eczema in her child. That sort of information to me is astounding in so many ways, and it tells us that all of that microbiota and just all of that amazing ecology, that transfer does a lot more than I think that we realize. And I think that as science continues to unravel, we'll realize that perhaps part of how diseases manifest in utero is related to that ecology.
Because, that's just, it's fascinating, because we've got what's going on in the sac, we've got what's going on around the sac, and the mother's microbiome interrelating with the child already at that point, determining so many things. I mean, you're doing a PhD on these biomarkers of ovarian health. So mind-boggling. I feel like I'm on the Fantastic Voyage here. Do you remember that program where that film is probably way before your time? But anyway, we won't go into the Fantastic Voyage. We're on it right now. So we kind of, the baby is, the embryo is developing, and of course then it's time to give birth. And there's a whole story there, isn't there? Because vaginal and increasingly cesarean. Talk us through, what the pluses and minuses and challenges of that are.
Look, in an optimal scenario, and I'll put a little caveat here that not only do I want to support women's birth choices, but I think that there are circumstances that a woman needs a cesarean. So there's no part of me that wants to make any woman feel bad here, but the ideal and optimal scenario is to have a vaginal delivery. And the reasons behind that are, multifold. However, what we do know is that as the baby passes through the birth canal, not only is all of its skin covered in all of the microbiome from her vagina, we also know that it swallows it, and so it's born with a sterile digestive system, but the swallowing of all of those secretions help to set up the initial fingerprint or blueprint for their ecology for the rest of their life as well. There was an amazing professor that did a study looking at a number of different women that birthed, and he assessed the probiotic species of the digestive systems of all of those babies by testing the stool, and he found that what was present in the room that the children birthed in influenced the types of species that they had. So someone had a plant in the room, so they had plantarum species of probiotics. Someone had a dog in the room. Like, they had all sorts of different things in the room. And so not only is it the secretions, but it's also recognizing that as that baby comes out of the vagina, their skin is incredibly permeable for good reason, and they absorb everything around them. It's phenomenally interesting. And that's also another reason why it's really helpful to leave that beautiful vernix that the babies come out of the canal in, and to leave it on them for a good 5 days and not wash them, because they're absorbing that, and that influences the start of all those good colonies as well.
Wow. Now, I haven't heard that before. That is fascinating.
Yeah, it's amazing. I mean, there's that habit of, oh, we need to make them sterile,
Yeah.
like come out and they're dirty. Well,
Yes.
they're not dirty. I mean, obviously wipe off things that might be inappropriate, like if there's blood or something, but that wonderful sticky sort of thick coating that's all over their body, that's really, really important. They absorb it through their skin. It's extremely permeable, their skin, and it sets off that ecology, which is, I think, really fascinating. And I mean, if a woman has a cesarean delivery, it's not as ideal for many different reasons. Simple things like they don't get the massage as they're going through the vaginal canal that helps to clean out their lungs, or, they don't obviously get to swallow all of those secretions. But, there's a lot of research coming out looking at the process of seeding, where the woman puts a gauze into her vagina and then can put that around the baby's mouth and nose and everything once they've been delivered. And there are certainly a lot of midwives especially, but a lot of obstetricians that are pro that practice, because they know that then that exposes the baby to things that they would have received from that vaginal delivery.
That would seem to make very good sense to me.
I think it does. I really think it does. I mean, there was a paper that came out in Nature not too long ago that showed that after 6 weeks that babies born vaginally and babies born via cesarean had almost equal ecology. But there's not a lot of research in that area. So I still think at this point that if a woman does have a cesarean, I personally recommend that they do the seedling process and that they also encourage specific bifidobacterium strains. It's an infantis strain to give to their baby for the first 6 weeks of life to give them that extra boost that they would have missed out from a vaginal delivery.
So, I mean, really, the vermix, this has got me fascinated that you don't wash for the first 5 days and because really when you think about it, throughout human history, we've become a little bit preoccupied. Well, a little bit is an understatement, but preoccupied with, got to be clean, got to be dead right as soon as they're born. My God, they've just come out of this. Where have they just come out of? It's not so dirty, we kind of have this bizarre preoccupation. Listen, I know we're going to get on. We're moving on. Oh no, I've got to ask you. Okay, breast. I'm getting ahead of myself here. So we've talked about that, breastfeeding, and that is another opportunity, isn't it?
Well, look, breastfeeding's, it's designed for that very purpose. I mean, the colostrum that comes through in the first few days after the baby's been born, it's likened to liquid gold. There's nothing quite like colostrum from your mother to set your immune system on the best footing. And once the milk actually comes in, yes, breast is best. And there are unfortunately some women that have difficulty with it. It's a skill, first child, everyone has to learn how to breastfeed. It is something that comes innately, but it's a skill, and some women struggle. The only women that I've ever seen that can't really fully breastfeed are women that tend to have a deficiency in breast tissue development for certain reasons. But otherwise, I think that every woman can. But ultimately, of course, it's her choice. And if she chooses not to, that's absolutely up to her. Again, no judgment. But you can never recreate breast milk. There is no way that any company, Nestle, with all their wisdom and science, they would never be able to replicate breast milk. There are things in breast milk that we don't even understand how it's in there. I mean, the way that a woman can have letdown, which is the process when she knows that her breasts are filled with milk. And she can have letdown when she's in another state, when her child is crying at home and needs to be fed. There are things that go on between the mother and baby that we do not understand. The constituents within the milk, the ability for it to change its constituents depending on if a child is about to have a bug, to give it extra microbiomes or extra ecology to assist in its defense against that bug, or to give it extra fat before it has a growth spurt, or that gentle trituration and adjustment of exactly what that child needs. There is no way that science can replicate it. And it's phenomenal how it nourishes the child. Like I thankfully was able to and breastfed both of my boys. And to this day, I look at how their health has been so dramatically improved, and they're just robust kids.
Gee, I got a chill down my spine when you said they could be in different states and the child needs feeding and the mother. And this is quantum physics.
Absolutely. I mean, I was listening to quantum physics something last night, so we won't go there.
Yeah.
But it's just phenomenal, and you just know when your child needs you. And that, the science has this thing called microchimerism where they've identified that you can have the chromosomes of your children left in your body. Particularly when you have boys, it's easier because it's a Y chromosome in a female. And so we know that parts of our kids are left in our body. And that interface and that link between the mother and child and that bond is it's phenomenal. It's absolutely phenomenal. And
give me that word again,
chimerism.
Chimerism, okay.
Chimerism.
Oh, God, I'm going to look that
one up. Microchimerism. And so they did all that research, just a tiny caveat, where they were identifying from previous male sexual partners the evidence of Y chromosome, and then they extended it to see our children and everything. So with girls, it's trickier because, everything's X chromosome, but Y is a bit easier.
Yeah. Now, you mentioned also probiotics, and again, I think this is a term that people hear, pro and prebiotics. Can we just go to a short definition for our listener so that we kind of are familiar with those two terms? Because we're going to be talking a little bit about them, I'm sure.
Yeah, of course. So a probiotic is something that promotes the growth of the good bacteria in the gut, the good species, and the prebiotic, well, it promotes the growth of it as well, but it's the initial precursor of it. So the probiotic gives you the actual strain that you can take to increase the ecology in your system, and the pre promotes the growth of the naturally occurring ones. So anything that is present, it assists in its subsequent growth.
So a probiotic would actually be a species of bacteria, and,
yes.
a pre might be something like sauerkraut or fibre or something to feed the bacteria.
Much better definition. I like that.
Okay. No, just a collaborative definition there, Leah.
Thank you.
Okay, what challenges our microbiome? What are some of the challenges as we're born, whether we're cesarean and vaginal or breastfed or not, but then we move on, what challenges it?
Everything in our environment.
Okay. The obvious one is antibiotics. And I mean, and like I had a patient we interviewed somebody the other day, who told me the story of this 2-year-old patient she had who had already had 10 courses of antibiotics and was on, get this, a protein pump inhibitor at 2. Oh my God, I thought, oh my God. But for those of us, and everybody listening to this has been on at least one course of antibiotics. What do you recommend when somebody takes an antibiotic? How do we restore because it affects the gut, how do we restore the gut? How do we use pro and prebiotics to do that?
Okay, so antibiotics, medical necessity in certain situations, absolutely, but I think that they are overused. However, if you take an antibiotic, it's really important to take the probiotics to replenish what has been damaged and to use the food sources of prebiotics to try to feed the good bacteria. And there's lots of research at the moment showing that the prebiotics have more long-lasting effect in the sense that they repair the natural, normal balance within the digestive system or other systems, more so than just adding a probiotic strain that may or may not actually be able to hang around for very long. So, prebiotic foods, like you mentioned, sauerkraut, any of the fermented foods, and you look at any traditional diet, they all have prebiotic foods that they ate regularly. It's the Western diet that's forgotten the way. So, all the fermented foods are cultured to be able to culture bacteria from the air and the actual substance that's being cultured. And, feeding that helps to feed all of the good cultures in the digestive system. Similarly, you can use all of the fibre-based products, things like inulin and guar gum and all of the psyllium husks and cyprium and all that sort of stuff to assist in the growth as well. And then in the probiotic aspect, you can use it both as probiotics that are naturally occurring in food, be it like yogurts and cultured foods, or be it from probiotic strains in supplements.
And what kind of a regime? Like if I was just, let me give you an example. I needed to take amoxil, 500 milligrams 3 times a day. Yes, I love the idea of the prebiotics because that makes so much more sense, and you should be on them all the time anyway. Yep. You probably wouldn't have got sick in the first place if you'd been on them, but that is an alert to tell you to do it. If I was taking probiotics with antibiotics, would I take them at the same time? Would I time it differently? How long would I have to keep going afterwards? What do you say to patients who are on that?
I think there's a few pieces here. So one is you can get some probiotics that are shown to be more antibiotic resistant than others. So some of the strains are ones that are better to take concurrently. But if someone took that type of amoxil dose, I'd be getting them to take probiotics at the same time, but a couple of hours away from the antibiotic, just to give it the best chance. And then if it was myself or my patient, I'd be taking it for a good 4 to 6 weeks after as well.
Mm-hmm. Yeah. Now, if somebody does have a gut microbiome that they think, oh my God, I'm really, this is dysbiosis, I think is the technical term. And we're so used to quick fixes. Can you just share with our listener how long it takes to rebuild a gut?
Look, it depends on the severity. Like if someone has a gut that's, a bit dysbiotic and it's been around for, couple of months since they had a tummy bug, that's one thing. But if they've been dysbiotic for 5 or 10 years, it's probably going to take a lot longer. On average, though, to repair the gut and to repair the flora, you're looking at a good intense treatment of 2 to 3 months as a minimum. Most people will feel better within the first 1 to 2 weeks, but if you're really wanting to repair the gut, wait until all the lining's been repaired, the liver's regenerated, all that sort of stuff, give it 3 months, and that's your best bet.
So as we get older now, moving away from the child and the breast, we focused on that. And you mentioned also that now we're in this unique position where 3 generations of women and men are trying to have children. What are some of the challenges as we get older? I mean, is it just that we're exposed to a lot more crap for longer, and is that it? Or does the microbiome change as we get older?
A bit of both. But I do think that, the duration of exposure to, for example, personal hygiene products, like if you look at a woman and the amount of exposure that, her vagina is exposed to, let's say, with sanitary products and soaps and creams and synthetic underwear and synthetic washing detergent and all that sort of stuff, that does tend to affect things over time. I think that we're all exposed to choices around toiletries that are disrupting all of the good bugs that are naturally on our skin. We've got kids that don't really play in dirt anymore. We've got kids that are using hand sterilizers every 5 seconds, and then as adults, they're continuing to do that. So everyone is very sterile, which means that all the naturally occurring bugs that should be present on their skin are vanishing, and that's having an internal impact as well. Our skin is our largest organ. We certainly absorb a lot through our skin, and that has an impact internally. So I just think everyone is very sterile.
Yeah. Actually, it raises an interesting issue because, going back to the vermix, which clearly has got me fascinated, but to take that to another level, we kind of get under the shower every day and we scrub ourselves down. I mean, I wonder whether we're doing ourselves a favour, apart from, the vital bits that make us socially acceptable. I wonder whether we should be scrubbing our arms and our legs and our torsos quite as vigorously. What do you think?
I'm not sure anymore. I think it comes also to the quality of the water that they're showering in, and then their skin absorbing all the chlorine from the water, and then the soap that they're using with the phthalates in it and the perfumes and all that. And then they put the body cream on, which has more chemicals, and then the washing detergent on the clothes. And do you know what I mean? Like, it's just this ripple effect. I'm less against the showering every day if it's clean water and natural products than I am against all the synthetic stuff that they're putting on top. That I find has more harm in some ways because, the phthalates, which, enable the smell and the perfume of that product to stick to your skin. What's that doing? Yeah. That's actually taking a spot which should actually have a bacteria on it. Are the bacteria getting super and are they overriding the phthalate? It's just a question, I don't know. Or is it actually that this chemical environmental pollutant is deranging what should naturally be there as a defense mechanism?
Yes, and not to mention the endocrine disrupting effect of those chemicals as well. Wow, yes, it is. Well, it just highlights really how making informed decisions is the biggest thing you've got going for you.
Absolutely.
Yeah. Now, with that in mind, what if now our listeners are kind of so motivated now? I mean, we've got them really on board here. What do you say? What would be your 2, 3, 4, or as many tips as you like to get us going and say, yes, I want to get going? What are some of the major sort of principal tips that you would give our listener?
I think it's about being very conscious, as you just mentioned, about everything that you're exposed to and everything that you put into your body for anyone at any stage of their life. So, Mark Hyman has that thing where he always says the most important thing that you can do, the most important decision is what you put on the end of your fork. So you think about what you're putting in and around your body, because that is going to be the most empowering thing that you can do. And if we go back to basics and remove all this extra stuff and all these extra chemicals, we can make an enormous difference. Yes, I'm pro, natural vaginal delivery. Yes, I'm pro preconception. I'm pro, probiotic support and prebiotics and cultures in food and all that sort of stuff. But I think that if a person eats really well and doesn't put all those chemicals in their lifestyle, their body has a much better chance of actually being able to do what it's designed to do.
That's a big one, isn't it? Okay, go on, give us another one.
Another one. I am a big advocate of women listening to their bodies. And I think that most women, if they listen to their bodies in the context of conception, pregnancy, all of those aspects, they naturally make choices that are actually the most beneficial. So what I always say to women is your sense of smell and taste and just natural attunement, when you're in that preconception pregnancy phase, is designed to protect you. So women always kind of go, oh my God, my sense of smell is ridiculous. I hate it. I'm like, no, love it. Because if you're smelling something that smells funny, it's there for a reason. And they forget that, yes, you now get a headache or feel queasy from your perfume. That's because your perfume's toxic. If your body feels like that food smells funny, it's because it will be harmful for you or the child, and then you won't be throwing up with gastro. It's an innate ability that is silenced, I think, in a lot of women, and it's not understood. So I think it's really, really helpful. Leading from that is really connecting to the idea that breastfeeding is an incredibly natural process and an incredibly bonding process for mums and their kids, and reminding themselves that their body is designed to do it, it knows how to do it. And sometimes it's just, about them connecting to, what I call the prolactin hum, where they just, remove all the external stimuli and they sit there and their body goes into a hum meditative space. And that's where, there's been studies that have shown that the quality of the milk changes and, the fat content increases and the bond with their child improves. And, there's all these natural, innate, relaxed aspects of health that I love seeing when women reconnect to it. It's really empowering for them.
Now, listen, finally, and I mean, you've said some things there which are applicable generally, but, for people in general on their health journey through life, what do you think the biggest challenge is for us in this modern world?
The space and the quiet to hear, so that they can know exactly where they're at minute to minute, and so that they can hear their body and know what their body's needing. I think that we get very caught up in, okay, I'm blood type, I need this diet, or paleo is the best diet for me, or whatever it might be. But realizing that we flow, we grow, we change, we evolve, and similarly, how we support our bodies needs to be reflected in that regard. You'll have periods of life where you'll need to protein load in your diet, and you'll have periods in life where you'll need to fast. You'll have periods where you'll need to be extroverted and periods where you'll need to be introverted. And really just allowing yourself the freedom to go, we're constantly in process. We're shifting, we're changing, we're evolving, and being respectful of that. I don't want anyone to ever feel like they have to be on a supplement for the rest of their life. I want them to be attuned to know that it feels like this supplement is right at this point, and then it can change.
Leah, thank you so much. I mean, it's been terrific. We've covered some great territory there. We're going to have links to your website. I'm really looking forward to hearing and seeing you at mine. So thank you so much for joining us today.
Thank you so much, Ron. Appreciate it.
Well, this is quite a story, isn't it? The microbiome in and on our body. The gut microbiome. The gut as the home of 80% of our immune system. The gut as the second brain, affecting your mood. And this story is just going to get bigger and bigger. The significance of our relationship with our microbiome is going to get more and more interesting. I mean, it already is. We're just going to be learning more and more about it. And I love Leah's "we need space and quiet to flow, grow, change and evolve. Fantastic. Now, whether you're trying to conceive a child or not, whether you want that child or for that matter, that adult to be healthy, if you want a hopefully long and healthy life, the question we need to constantly be asking ourselves is, am I feeding my friends or my foes? In microbiome terms. We've taken a very adversarial approach to microbes in and around our bodies, in our homes, in our soils. And there's no doubt that hygiene's important, that's for sure. Clean water, sanitation, washing your hands, brushing and flossing your teeth are also really important. But there's a balance to be had and a synergy. Learning to find a healthy balance is much healthier, more achievable and more sustainable. It's a better way to go. By the way, we talked about breastfeeding, and I should add that one thing that is easy to overlook when a woman is having trouble breastfeeding is that the child may have tongue tie or lip tie. Now that means the ligament which attaches the tongue to the floor of the mouth is short and tight, and the infant can't latch on to the nipple. I had to throw that in because it's one that's very easy to overlook. Now, we also mentioned MIND, and it's the MIND Foundation, MINDD. Now, it's an acronym, and it stands for M, metabolic, I, immunological, N, neurological, D, digestive, and D, degenerative Foundation. It's a great organisation which each May in Sydney holds a forum, and this year is the 10th annual forum. It's going from the 11th to the 13th of May 2018 at the University of New South Wales in Sydney, exploring all those themes with a focus that I've just listed in the MIND acronym, with a focus on children's health, but of course it's just as relevant to adults as well. Now, there's always two streams, one for health practitioners and one for the public, and this year the public is being live streamed, so you can watch it from your own home and participate. And if you've missed it and you're listening to this podcast afterwards, you can watch the whole program again. There are some great presentations. Leah gave us a preview of hers today. I'm going to be talking about the mouth as the gateway to good health. There are lots of others. It's a fantastic, well, you can choose 1, 2, or the whole 3-day program. I'm actually emceeing the whole, a couple of the days of the public stream. We'll have links to the Mind Foundation. Of course, we'll have links to Leah Hechtman's website, which includes some great health blogs which cover a very wide range of topics. Hope you've enjoyed this episode. Go to the show notes on my website for all those links. Help me spread the word. Leave a review on iTunes. We have been getting some great feedback, which is great. So thank you. So until next time, this is Dr. Ron Ehrlich. Be well. This podcast provides general information and discussion about medicine, health, and related subjects. The content is not intended and should not be construed as medical advice or as a substitute for care by a qualified medical practitioner. If you or any other person has a medical concern, he or she should consult with an appropriately qualified medical practitioner. Guests who speak in this podcast